go in the cranial direction, or I can go in the lateral direction. So I'll show you what that means. If I'm over here, just to get the technique right, if I'm going to go in the cranial direction, okay, I'm going to put my 2 fingers down. Those are going to be the ones that are on the skin. And then my cranial hand, my hand that's closest to her head, is going to come over here. I'm going to use my hypothenar eminence, really the ulnar side of my hand, okay? And I'm just going to put pressure and move it on the skin. So if this is an area I want to get, and I really want to get this muscle, I may come here, take up the slack, put the pressure down, and just keep rolling it upward. As soon as I get there to where her skin won't let me go anymore, that's where I'm done. Okay? Not that I can't get this area, but when I'm going through and doing this mobilization, I stop there. Now if I get here and I'm satisfied with what I'm doing to the tissue, meaning, okay, the tissue feels better, they say it feels better, then I can change positions, and instead of being here, I say, okay, I feel like I've taken care of that area, that restriction, I can work my way up and do the same thing. And so another thing, does that feel all right? Another thing that I can do is, at first, if they're really, really tender here, is I start out with just a little bit of pressure. I want to work my way into it. Okay, and then as I feel like it's starting to release, I communicate with the patient. She says, yeah, that feels good. Then I can go a little bit deeper because I really want to get into that muscle and break up those restrictions in there. Okay, so let's say she's all the way up and down the paraspinal. She's restricted. Then I can work my way up here, work on this for a while. It may be 1 minute. It may be 5 minutes. Okay, but how do you know when you're done? Anybody have an answer there?
Feel better?
Yeah. Yeah, so either when you're saying, okay, you know, they feel better, or you say, I've been doing this for too long, I should have gotten a result, and I'm not getting it. I need to try something else. Okay? So that would be the cranial mobilization. Okay? Now, if I want to do a lateral, it's going to be about the same thing. My cranial hand's going to be on top. My thumb's going to be pointing caudally towards the feet. But I'm just going to use the thumb. So the first one I was here using the fingers and going in the cranial direction. And now if I want to go lateral, I use the thumb as kind of my dummy finger. And I just go lateral. Okay? If I'm here and I want to get up to this area or a little bit more lateral, then I go here. If it stops there, I may take up a little more slack. Just work on that area. Make sense?